So hello, my name is Charles. I'm a final year medical student. So today I'm going to be talking to you about how to approach a history station.
Codeine for the pain, less rain in my days, sunshine in my days.
So when it comes to an OSCE station, the first and foremost thing you have to remember, especially when attacking a history station, is structure. Structure is one of the most important things that you can have. After structure, the way how you communicate with the patient and how well it flows is the second most important thing, as if the patient feels comfortable, they're more likely to let you know more information about what's happening with their condition. And the last thing that's important is being empathetic. Starting off with structure is very important for your consultation to be structured in such a way that even if the examiner zones out for a good 2 minutes, they can come back in and know exactly where you are in the history. There's no point in having a history that's jumbled up, that doesn't follow a clear logical sequence. It has to make sense. Remember, if the examiner can follow what you're doing, then they can tick off all the different relevant parts in the mark scheme. The first thing that you start off with is introducing yourself. Get the patient to introduce themselves with some identifiable information so you know it's them. Make sure you've got the correct patient in front of you. Moving on, present a complaint, what the patient is coming with. That's going to be their own words. Ask an open question, get the patient to tell you why they've come. You're going to follow on to history of presenting complaint. So you want to figure out how long this problem has been going on for. Has it been getting worse? What other things have been happening apart from this? So depending on what system that you think this presenting complaint is coming from, that will align you into what sort of cardinal symptoms you're going to ask. For example, if somebody comes in with chest pain, you're going to be thinking about asking cardiovascular history cardinals. So you're going to be asking about Socrates, side onset, character radiation, associated symptoms, timing, exacerbation, alleviation, and severity. Other things you can ask about if they had dizziness, syncope, falls, loss of consciousness, they've had palpitations, swollen legs, ankle edema, claudication, and shortness of breath. You also want to include and follow this up with some red flag symptoms that you might be worried about. Each history will have its own set of red flags, and make sure you know those before you go into the history so you can ask those. There will be marks for those kinds of things. After I've done history presenting complaint, what I like to move on after that is something called ICE, so ideas, concerns, and expectations. What do you think is going on? Ideas. Is there anything that you're worried about? Concerns. And what do you expect, or what were you hoping for me to do for you today? So you know exactly what the patient is looking for. Are they coming for some reassurance, medication, referral? You need to understand what they're coming for so you can address that thing, or at least speak to them about it. After history presenting complaint, you've asked your ICE, you want to move on to past medical history. There are two ways of tackling this. You can simply ask them, is there anything they come into hospital for, operations, anything they go to the GP for regularly? Or if you're short of time and you want it to be really focused, you can actually ask specific risk factor related conditions to the presentation. For example, they've come with chest pain, you think it might be angina, you can ask if they have diabetes, high blood pressure, high cholesterol, if they've suffered from strokes, if they suffer from AF, those kinds of conditions, as those are most likely to be related. Moving on to family history, you can also ask any conditions that run in the family and any of those risk factor conditions that have a genetic component to them if relevant. After you've asked about family history, you're going to move on to drug history. You're going to ask what medications they're currently taking, and you want to know if they have any allergies. Now, obviously, for important reasons, if you're going to be prescribing a medication afterwards, you need to know what medication they're on. If they have any allergies, you need to know it so you can avoid it. If they do have an allergy, ask them what happens. You want to know if it's a true allergy or not, as this is important, especially if you've got limited treatment options. After this, you want to move on to social history. So for social history, ask them how many they smoked, when did they start, and if they've stopped, when did they stop, how many they smoked a day. Ask about alcohol, how many units do they consume a week, and for how long they've been drinking for. Ask if they take any recreational drugs like cocaine, weed, all those kinds of things there. And also ask about activities of daily living, how they get around the house, how is this condition affecting them in terms of what they can do, and also what do they do for an occupation, as this might be associated and linked. After this, you want to do a systems review. So usually when you do a systems review, you want to do a system above and a system below if you can. For example, if somebody comes with chest pain, you can ask about respiratory, you can also ask about GI, as these can also present in the same way. And also think about your differentials. You want to rule them out and rule in. So if somebody comes with chest pain, it could also be linked to anxiety. So make sure you ask anxiety related questions as well if they've been stressed. After that, you want to summarize the whole history to the patient to make sure that this serves two purposes. One, it shows the patient you were listening. Second of all, shows the examiner asked everything. And if they've missed anything that they weren't sure if you hadn't asked, it's an opportunity for you to get those marks. And make sure you end the consultation in a timely manner. Hopefully a good history should take you about 6 to 7 minutes, probably 7 minutes if you really press for time. Make sure you understand how your OSCE station works, because some stations, like in my uni, you will take the history for 6 minutes, then it'll be a minute of questioning. So make sure you understand that structure and you practice appropriately. Don't rush your history so much that you lose rapport, but don't have too much rapport that limits you from completing your history, because if you don't complete your history, you won't get the marks. It's about finding the balance. If you have any questions, ask them below.
Codeine for the pain, less rain in my days, sunshine in my days. Lately, I miss your rays. Sometimes I gaze, daydream, stuck in this maze. You ain't gonna change for nobody else. You're set in your ways. I ain't tryna live my life up on a friend zone. Rather have you by my side, or rather